Onc Live Insights is a video editorial program produced by Onc Live.
I think for all of these side effects, an important principle is that a break in therapy can really help. So if you have a patient who's having a bothersome rash or diarrhea or paronychia or really any bothersome side effect, with oral chemotherapies like afatinib or some of the other targeted drugs, one of the most effective things to do immediately is to take a short break from the treatment. Let the drug wash out of the system, let the side effect calm down a little bit. A lot of times if you do an early break in treatment, you can actually restart the patient at the same dose and they can do much better the second time around. That giving your body that reset can really help, and you don't always have to do a dose reduction. If you let the toxicity get worse and worse and worse and keep treating through it, sometimes it gets to a point where you really do need to do a dose reduction. So early dose interruption for a short period of time can help you keep the dose up in the long run.
I think it's important to realize that we've never really established the optimal biologic dose of the agents that we use. And I think the side effect profile brings this forth. We know that going above 150 milligrams daily with erlotinib or above 40 milligrams daily with afatinib is associated with a much higher risk of side effects. But we've never really tested whether 50 milligrams daily of erlotinib or 20 or 30 milligrams daily of afatinib is just as effective as the higher doses. So I would strongly advocate for prospective trials going forward to compare lower versus standard doses. I suspect the therapeutic advantages will be maintained and we will see less in the way of side effects. And in turn, compliance will improve and perhaps the beneficial effects will be greater. So in general, if we observe toxicities of this sort, whether it's diarrhea or skin rash or rare ILD, interstitial lung disease, switching from one agent to another doesn't necessarily prevent or mitigate the toxicity. It's a class phenomena, and it's unlikely that the side effects will automatically disappear. I have to confess, on occasion, I have switched from one to the other with the hope that perhaps the second agent will yield less in the way of side effects, but I've been disappointed.